Assalamualaikum. I'm Shanza Shehzadi from MS Chemistry Batch 1. Today, the topic I'm discussing in this presentation is the medicine of heart and kidney. In the next slide, I will discussing my table of content. What is a heart? What does a heart do? What is a kidney? What does a kidney do? Connection between kidney and heart. Symptoms of heart diseases. Types of heart diseases. Test for heart diseases. Medicine for the treatment of heart. Treatment of kidney diseases. Symptoms of kidney diseases. Test to measure kidney function. Medicine for the treatment of kidney. In my first slide, I will give you the brief introduction about heart. What is a heart? The heart is a face-sized organ that pumps blood throughout your body. It's the primary organ of your circulatory system. Your heart contains four main sections. Now you can say these sections, chambers of the heart, made of muscle and powered by electrical impulses. Your brain and nervous system direct your heart function. In the next slide, I will explain the diagram of heart. Now I will moving my cursor to explain this diagram. The first, my cursor is on the superior vena cava. Superior vena cava carry blood to heart. Below the superior vena cava, right atrium is present. This is the chamber of heart. Below the right atrium, there is the right ventricles. This is also a chamber of heart. This is the biggest chamber of heart. Below the right ventricles, inferior vena cava that carry blood to heart. On the left side of the diagram, my cursor is on the aorta. Aorta carry blood to bodies. Below the aorta, pulmonary arteries are present that carry blood to lungs. And below the pulmonary arteries, pulmonary veins are present, carry blood from lungs. Blood take oxygen from the lungs. Through pulmonary artery, the blood enter into the lungs, and after carrying oxygen, it back to heart through pulmonary veins. There is a left atrium. This is a chamber of heart, and left ventricles. These are the four chambers of heart. The upper are the atrium, and the lower are the ventricle. In my next slide, I'm discussing the job of heart. What does the heart do? The heart is a muscle that pumps blood filled with oxygen to all parts of your body. This job keep every cell, organ and system alive within your body. To move blood to each part of your body, your heart release on your body on your blood vessels. Together the heart, blood and blood vessels make up a system called the cardiovascular system. In the next slide, I'm discussing about kidney. What is a kidney? The kidney are two bean-shaped organs. The kidney are present in our body in pair form, each about the size of a fist. They are located just below the rib cage, one on each side of your spine. Healthy kidney filter about a half cup of blood every minute, removing waste and extra water to make a urine. In the next slide, I'm discussing the anatomy of kidney. Now I'm moving my cursor to explain the kidney anatomy. The first, my cursor is on the hilum. Hilum is a depression point where all blood vessels are entered into the organ. Below the hilum, renal arteries are present. Renal arteries are the large blood vessels that carry blood from your heart to your kidney. Below the renal arteries, renal veins are present. These are the main blood vessels that carry blood from kidney to heart. Below the renal veins, renal pelvis is present. The renal pelvis acts like a funnel that collects urine produced in the kidney. There is a ureter. Ureter also carry urine out of the kidney. Two types of calyx, major and minor calyx. On the left side of this diagram, there is a renal cortex. Renal cortex is the outer layer of the kidney. Outer part of the kidney is the renal cortex, and renal medulla is the inner part of the kidney. Below the renal medulla, renal papilla is present. Renal papilla is the location where the renal pyramid in the medulla empty urine into the minor callus, the kidney. Below the renal papilla, renal pyramids are present. Renal pyramids are cone-like structures that present in the kidney. There is the renal columns that radiate downward from the cortex through the medulla. Jobs of kidney. In this slide, I'm discussing the jobs of kidney. Your kidney are powerful chemical factory and have the following jobs. The first, clean your blood of waste products and extra water. Help control blood pressure, keep bones healthy and strong. Make red blood cells, keep the balance of mineral in your blood. Minerals like sodium, phosphorus and potassium. Here is the functioning of kidney. The blood enter into the kidney through renal arteries. These are red in colors. Blood enter in kidney through renal arteries, and below the renal arteries are renal veins that are blue in color. After removing extra waste and excess water, the blood leave kidney from this renal vein. The waste are removed from the kidney through ureter that carry urine outside the kidney. After ureters, the urine is go to the urinary bladders where it's stored for some time, and after that it release in through urethra. How does the kidney and heart work together? The heart pumps blood filled with oxygen through all parts of your body, including the kidneys. The kidneys clean the blood, removing waste product and extra water. Without kidney, your blood would have too much waste and water. Without the heart, your kidney would not have the oxygen filled with blood needed to do its many important jobs. Without the help of your kidney, the heart would be working too hard or would not function at all. A healthy functioning cardiovascular system is important for your kidney to their job. In my next slide, I'm discussing the connection between heart and kidney diseases. When your heart or kidney cannot function normally, it can lead to cardiovascular disease. Cardiovascular disease are the heart diseases or kidney diseases. It is important to know that having kidney disease can directly affect your chance of developing heart disease. Having a heart disease can directly affect your chance of developing kidney disease. In fact, kidney disease and heart disease share many of the same risk factors, such as diabetes and high blood pressure. The risk factor are the diabetes and high blood pressure. These are the cause of kidney and heart diseases. Symptoms of heart diseases. Symptoms of heart disease depend on the type of heart disease you have. The first is the chest pain, second is the shortness of breath, third is nausea, fourth is extreme fatigue, and the fifth is pain, numbness, weakness, or coldness in your legs or arm. The other symptoms are pain in the neck, jaw, throat, upper abdomen or back, swelling of the leg, ankle, and feet, irregular heartbeat that feel rapid pounding or fluttering, dizziness, lightheadedness, and fainting. Heart disease is easier to treat when caught earlier, so be sure to tell your doctor if you ever feel symptoms or have a concern about your risk. Types of heart diseases. The first is the coronary artery diseases. You can say it there, CAD. Heart failure, heart valve disease, pericardial disease, cardiomyopathy, heart muscle disease, congenital heart diseases. These are the types of heart disease. The first is the coronary arteries. In this disease, arteries that supply oxygen and blood to the heart become narrow. And second is the heart valve. One or more of the valve in the heart are not working well. And third is the congenital heart. Children may have these diseases. Then is the arrhythmia. This is the abnormal heart rhythm. If your heart rhythms are not normal, you have arrhythmia and is the heart failure. Heart does not have enough strength to pump. Heart muscles, heart walls become thick or heart become enlarged. In the next slide, I'm discussing the most common disease, that is the heart attack. What is a heart attack? A heart attack, also called a myocardial infarction, happen when a part of the heart muscle doesn't get enough blood. The more time that passes without treatment to restore blood flow, the greater the damage to the heart muscle. Coronary artery diseases is the main cause of heart attack. Tests for the heart diseases. If you are having symptoms, there are many tests that your doctors might suggest. The type of test they recommend depend on what type of heart disease your doctor think you may have. The test may include blood work, chest x-ray, and other tests. These are the type of tests. Electrocardiogram. You can say this: ECG, Holter monitoring, echocardiogram, cardiac catheterization, cardiac computed tomography scan. You can say this: CT scan, cardiac magnetic resonance imaging. You can say this: MRI. The first is electrocardiogram. ECG help your doctor to find problem with your heart rhythm. If you have a problem with the rhythm of your heart, doctor can detect it through the ECG. You may have a in ECG while resting or while exercising. The second is the Holter monitoring. A Holter monitoring is a device that you wear for 24 to 72 hours to record continuous ECG. Your doctor may use this if they do not find anything out of the ordinary during a regular ECG exam. Third is the echocardiogram. Echocardiogram is an ultrasound of your chest that shows detailed image of your heart structure and how it's working. And next is the cardiac catheterization. Cardiac catheterization helps your doctor measure pressure in your heart chamber and look at blood flow through vessel and valve to check for anything that is not normal. Next is the cardiac computed tomography scan. You can say that CT scan. This test does a scan of your heart from many angles using a rotating X-ray. It is used to identify a variety of problems. Then the next is the cardiac magnetic resonance imaging, MRI. Cardiac MRI is a very sensitive test that uses a magnetic field to take a picture of your heart. In the next slide, medicine to treat heart diseases. If you have heart disease or high blood pressure and CKD is the chronic kidney disease, your doctor may prescribe medicine to control your heart disease or high blood pressure. Medicine for the treatment of heart diseases are the diuretics, ACE inhibitor, angiotensin, and beta blockers, aldosterone receptor. The first is the diuretics. Diuretics are also known as a water tablet. Diuretics can reduce blood pressure, remove excess fluid, and help your kidney get rid of more water and salt. Most common diuretic is a thiazide. Thiazide is the most commonly prescribed diuretics. They most often used to treat high blood pressure. Some thiazide diuretics are the chlorothalidone, hydrochlorothiazide, and metalazone. Next are the ACE inhibitor. ACE is angiotensin converting enzyme inhibitor. And medication. that help relax the vein and artery to lower blood pressure. AC inhibitor, heart medicine that widen your blood vessel, lower blood pressure, and improve blood flow. This help decrease the amount of work the heart has to do. They also help block a substance in the blood called angiotensin that is made of a result of heart failure. Angiotensin is one of the most powerful blood vessel narrowers in the body. Examples of some ACE inhibitors are benazepril, captopril, fosinopril, lisinopril, quinopril. Pril is the suffix that is used the naming of this medicine. After that, beta blockers. Beta blocker drugs that reduce blood pressure by blocking adrenaline, which help your heart beat more slowly and with less force, which lower blood pressure. Beta blockers also help widen vein and artery to improve blood flow. There are some examples of beta blockers: atenolol, metoprolol, betaxolol. Next is the aldosterone receptor blockers. Aldosterone receptor blocker is a type of diuretics that is used to treat congestive heart failure. CHF is the congestive heart failure. It is also called a heart failure. This is a serious condition in which the heart doesn't pump blood, as doesn't mean. Despite its name, heart failure doesn't mean that the heart has literally failed or is about to stop working. Some important points: some of these medicine may cause problem with your kidney. If you use hard medicine, these can cause problem for your kidney. Talk to your doctor about which medicine could work best for you. Your doctor may also recommend an exercise program or suggest you visit a dietitian to create a kidney and heart friendly diet. And the next slide, the treatments of the kidney diseases. What are the treatments for kidney diseases? If a condition is chronic, that means it is a long-term condition. If you have a chronic kidney disease, you and your doctor will manage it together. The goal is to slow it down so that your kidney can still do their jobs, which is the which is to filter waste and extra water out of your blood so that you can get rid of them when you pee. First, your doctor will work to find out what causes the kidney disease. First, doctor find the cause of your kidney disease. First instance, it can happen if you have a diabetes and high blood pressure. If you have diabetes and high blood pressure, you also have a kidney disease, you may work with a nephrologist. Nephrologists are the doctors who specialize in kidney diseases. You will take medicine and may need to change your diet. If you have diabetes, it need to be managed. If your kidney don't work anymore, you might need dialysis. Dialysis are the machines that filter your blood, and you could talk with your doctor about whether a kidney transplant would help. Symptoms for the diseases of kidney are the weight loss and poor appetite, swollen ankle, feet, or hand as a result of water retention, shortness of breath, tiredness, blood in your urine, and increased need to urine, particularly at night, difficulty sleeping, itchy skin. Types of kidney disease. The most common type is the chronic kidney disease. The most common form of kidney disease is the chronic kidney disease. And second is the kidney stone. Kidney stone is the another common kidney problem, glomerular nephritis, polycystic kidney disease, urinary tract infection. Tests to measure the functioning of a kidney. Healthy kidney remove waste and excess fluid from the blood. Blood and urine tests show how well the kidney are doing their job and how quickly body waste are being removed. Urine tests can also detect whether the kidney are leaking abnormal amounts of protein, is a sign of kidney damage. Types of tests: blood test, urine test, imaging test, and kidney biopsy. The first is the blood test. There are three types of blood tests: serum creatinine, blood urea nitrogen, glomerular filtrate rate. First is the serum creatinine test. Serum creatinine is a waste product that comes from the normal wear and tear on your muscle of the body. Creatinine level in the body is depend on the age and body size. A creatinine level of greater than 1.2 for women and greater than 1.4 for men are the sign that kidney are not working properly. A kidney disease progresses, the level of creatinine in the blood rises. There is the level of kidney. There is a level of creatinine. In men, the creatinine in blood sample is 0.6 to 1.2 milligram per deciliter, but in urine, 107 to 139 ml per minute. In women, the creatinine in blood is 0.5 to 1.1 and in urine, 87 to 107 ml per minute. In teenagers, the blood creatinine level is 0.5 to 1.0 and in children 0.3 to 0.7. Next is the glomerular filtration rate. This test is a measure how well the kidney are removing waste and excess fluid from the blood. It is calculated from the serum creatinine level using age and gender. Normal GFR can vary according to age. As you get older, it can decrease. The normal value of GFR is 19 or above. A GFR below 60 is a sign that kidney are not working properly. Once the GFR decreases below 15, one is at a high risk for the needing treatment for kidney failure such as dialysis and kidney transplant. Third is the blood urea nitrogen. Urea nitrogen comes from the breakdown of protein in the food you eat. A normal VUN level is between 7 and 20. As kidney function decreases, the burn level rises. There is a table in which typical adult references range for test of renal function, in which the sodium is 135 to 148 millimole per liter, and potassium is 3.5 to 5.0 millimole per liter, and chloride is 95 to 105 millimole per liter, and serum creatinine is 0.7 to 1.4 milligram per deciliter. Creatinine clearance is 97 to 137 ml per minute in males and 87 to 128 ml per minute in females. Blood urea nitrogen is 70 to 20 milligram per deciliter. Imaging test is the ultrasound and CT scan. Ultrasound, this is the test used sound wave to get picture of the kidney. It may be used to look for abnormality in the size or position of the kidney or for obstruction such as stone or tumor. CT scan, imaging technique use X-ray to picture the kidney. It may also be used to look for structural abnormalities and in the presence of obstructions. This test requires the use of intravenous contrast dye, which can be of concern for those with kidney disease. Kidney biopsy is done occasionally for one of the following reasons. The first is to identify a specific disease process and determine whether it will respond to treatment, to evaluate the amount of damage that has occurred in the kidney, to find out why a kidney transplant may not be doing well. A kidney biopsy is performed by using a thin needle with the sharp cutting edge to slice small piece of kidney tissue for examination under a microscope. In this technique, the small tissue of kidney is cut and measured under the microscope. Urine test, urinalysis, urine protein, albumin-to-creatinine ratio, and creatinine clearance. First is the urinalysis. Urine analysis is the including microscopic examination of a urine sample as well as a dipstick test, in which the dipstick is used to measure the urine. The dipstick is a chemical treated strip which is dipped into a urine sample. The strip change color in the presence of abnormality such as excess amount of protein, blood, pus, bacteria, and sugar. Urine analysis can help to detect a variety of kidney and urinary tract disorders, including chronic kidney disease, diabetes, bladder infections, and kidney stone. Urine protein. This may be done a part of urine analysis by a separate dipstick. In this test, a separate dipstick is used and excess amount of protein in the urine is called proteinuria. A positive dipstick test should be confirmed using a more specific dipstick test, such as the albumin-specific dipstick or a quantitative measure such as albumin-to-creatinine ratio. Albumin-to-creatinine ratio (ACR). This is a urine test to see how well your kidney are working. First, the amount of albumin in your kidney is measured. Albumin is most common type of protein found in your urine. Higher amount of albumin in the urine can be a sign that your kidney are not working as well as they should. ACR is calculated by dividing the amount of urine albumin by the amount of urine creatinine. When ACR below 30 is considered normal. ACR between 30 to 300 means you have moderate increased albuminuria, and ACR above 300 means you have severely increased albuminuria. Creatinine clearance test. Creatinine is a waste product that comes from the normal wear and tear on the muscle of the body. Creatinine clearance test compare the creatinine in a 24-hour sample of urine to creatinine level in your blood to show how much waste product the kidney are filtering out each minute. Treatment for the kidney disease. There are three types of treatment for the kidney disease are the medication, dialysis, and kidney transplant. First is the medicine, ACE inhibitor and ARBs. Some ACE inhibitors are captopril, enalapril, fosinopril, and ARBs are azilsartan, aprosartan, ebrasartan. ACE and ARBs medicine. ACE are the angiotensin converting enzyme inhibitor and are the angiotensin 2 receptor blockers are the medicine that help to protect the kidney. Having high pressure cause an increase of pressure in the blood vessels of the kidney. The blood vessel cannot work properly. This causes damage to the kidney. ACE and ARB medicine lower the pressure inside of the kidney to a better level. They are especially helpful for kidney that are letting protein leak into the urine. Kidney are not supposed to release protein into the urine. ACE and ARB medicine lower blood pressure in the rest of the body by relaxing the blood pressure. It lowers the blood pressure by relaxing the blood vessel. For people with chronic kidney disease, taking ACE and ARB medicine reduce their chance of needing dialysis or kidney transplant. People who take these medicine are also less likely to have a heart attack and stroke. Potential side effects of ACE and ARB medicines. Most people do not experience side effects when they take an ACE and ARB's medicine, but some people do have side effects. Side effect can be a cough, high potassium level in the blood, low blood pressure, dizziness, headache, and drownism. Doctor may want to monitor their patient to see how they respond to starting an ACE and ARB in medicines. The second treatment is the dialysis. Dialysis is a treatment that does some of things done by healthy kidney. It needed when your own kidney can no longer take care of your body needs. If your kidney is not working properly, you need to a dialysis to performing their functioning. When is dialysis needed? You need dialysis when you develop end stage kidney failure. When you have an end stage kidney failure, you need to do dialysis. Usually, by time you lose about 85 to 90% of your kidney function and have a GFR is greater less than 15. What does dialysis do? When your kidney fail, dialysis keep your body in balance by removing waste, salt, and extra water to prevent them from building up in the body, keeping a safe level of certain chemical in your blood, such as potassium, sodium, and bicarbonate, helping to control blood pressure. Thank you so much for listening. This is enough from my side.